Hi class, we're on week 3 of group human communications in group. It's 1 week. Week at the end of week 4 is when your videos are due. So just as a reminder, please be working on them. The most difficult part about the whole video is trying to find people to be in it. And I know that's challenging. I have mentioned this in the previous lectures, but I'll mention it again. You can do it live or you can do it via Zoom, because I understand you might know people that are a long ways away, and it might be easier to do the project online versus trying to gather 5 or 6 people in person. So I give you permission to do that. I know I've mentioned that a couple times, but I keep getting emails about it. So I just wanted to remind you, you can do that, and I don't have a problem with it. So we're going to be talking about legal and ethical issues regarding group. There's clinical issues involving like you making your best therapeutic judgment. You have to remember legal mandates, so harm to self, others, elder abuse, child abuse. You learn that in professional practice 1 and 2. We talk about that a little bit. You should have had probably law and ethics maybe already. And with that, you also learned about what's being a mandated reporter and things of that nature. And so please be mindful of that. Even in a group setting, we are still required to be mandated reporters. So therefore, you must still report anything that is not appropriate that's happening, or anything of that nature. So we also have to be mindful of cultural issues, gender, sexual orientation, religious affiliations, values, other differences that affect the way we understand and intervenes with clients' problems, countertransference, things of that nature. We need to be mindful of those things because we don't want that to affect us in group. And we don't want to be biased leaders. We want to be able to be very open-minded and objective to whatever it is that's happening. You will ask the group, even in group, to fill out a form consent. You'll probably have group rules. And the informed consent is just them agreeing to what the standards are of the group. So the nature of the group, the goals of the group, maybe the structure of the group, how often the group will meet, what's expected of them if they join, what they can expect from you as a leader. You might have time restraints, how many times they can miss, things of that nature. You want to make sure that everyone signs that. Group rules may be something you go over every week, not just the first week. And that's just to keep everybody on the same page and to help people be mindful of what they've signed up for and the purpose of group. But that's just something to be aware of. Many groups are composed of people who probably don't want to be in group. We think of that, we think of like some of the court mandated groups, anger management. Sometimes there's co-parenting ones that are forced by court. You may not have people who are super thrilled to be there, but they are still required to participate. We want to also remind people that despite whether they want to be there or not, that it may be beneficial for them to be there. And it might be helpful. And we don't want to assume just because people are forced to be there that they will not grow or change. Growth and change can happen even for those who originally maybe were a little bit more resistant to therapy, and then they decided to become more embracing of it. And as a result of that, they grow and flourish, So don't ever cut somebody out with what they have to offer, because it very well could make a huge difference. Freedom to withdraw from a group. Procedures for leaving a group need to be explained during the beginning session. Members have the right to leave. No one's a hostage. But it would be good for them to inform you as the leader before they make that decision. And group leaders must intervene if other members use undue pressure to force any member to remain in a group. We don't want to guilt someone into being in a group. We want people to be there because they want to be there. Even in involuntary situations, it's not our job to make people feel uncomfortable or forced to stay. So sometimes in group, these could be some of the issues that come up. There could be a misuse of power, whether it be by people who are in the group as peers or by the leader. too much self-disclosure, confidentiality, because remember, with a group, of course, we as clinicians are expected to keep things confidential. However, group members are too as well. The issue is we aren't in control of what people do once they go home. And as a result of that, sometimes people run their mouths or tell stories or talk about what happens at home, and you never know who can know someone that's in the group. And so that really is something for everyone to be mindful of is, we have an expectation of confidentiality, and we're doing that in respect for one another. So that's something to be aware of. There is a potential for scapegoating and confrontation. Confidentiality is the foundation of a group. Leaders need to define the parameters, including the limitations like I just discussed. And leaders need to talk to members about the consequences of breaching confidentiality, which may cause someone to have to leave the group, which is maybe very sad or upsetting, but it's just factual. We wouldn't, we would get fired if we did something like that. But we just want people to be mindful of their role in the group and how important it is to have confidentiality. And again, nothing should be posted on the internet. Talking about a person to other people, especially too if they're minors. We can't just tell their parents everything. All those kinds of things. The role of leaders' values in the group. So essential to be aware of your values and how they influence what you think. And, we just went through this really dynamic election process. It was so important to keep your values or your personal preferences or your personal thoughts to yourself, because people were making very big decisions off of maybe somebody's opinion, and then they couldn't be around somebody, and so we don't want to be like that. We don't want to be like that with other people, and of course we don't want people to be like that with us. So we want to make sure that we're mindful of how our values are being displayed to a group. We are Switzerland. We shouldn't be influencing people one way or the other. We are supposed to be neutral, and if too many of our values come out and they can be, of course you want to be respectable, you want to be a good listener, you want to have all those basic attending skills and be that kind of person, but you also should be kind of like a blank slate to some degree, because the group is not about you, it's about them. Now later we'll talk a little bit about how transference or telling a story or things of that nature can be beneficial, but we want to make sure we're doing it for the right reasons, okay, not just to talk about ourselves or something. There's the ACA Code of Ethics. Seeking consultation when we're struggling is important. That's why for most of you, when you start out, you're going to be a trainee and you're going to get supervision for hours. That will continue as an associate. You will get that supervision. And it's so nice to have that because you have a built-in person to run ideas by. So it's so important just to have someone to talk to and to see like, hey, I'm being challenged in this area. I don't know what to do. Do you have any thoughts or encouragement? All that is super helpful. And so I really encourage you to rely a lot on your supervisors for insight, advice, maybe to try to navigate how to handle hard situations, or you feel uncomfortable dealing with confrontation. Am I going to approach this correctly? That's what they're there for. They're a sounding board. So use your sounding board. Okay. Diversity. It's going to be part of your group. It's hopefully will be part of your group. Everyone can go through something that's very similar, but it's all going to affect us very differently. There's a lot of things that go into that, right? Like cultural things, gender, maybe sexual orientation, possibly, but something that brings us together is whatever the topic of the group is. And so we want to make sure we have an open mind when we're dealing with like a very diverse population. We need to have a multicultural approach. Some of the group norms generally associated with the group participation not be congruent with the cultural norms of some clients. So making sure people feel comfortable, it's a good fit for them. And we must understand the cultural values and norms, probably for most of the clients, that are part of that group. So maybe some of that might be some screening that you do ahead of time so you have a better understanding of the dynamic. Maybe some of those values are part of the topic of the group, so that kind of helps. Maybe it's just approaching it with the screening in general so you have a better idea of what this person's looking for and if group is a good fit for them. Regardless of it, we need to be mindful. We need to be mindful of a cultural approach and understanding the systemic differences between people. Okay. And then, of course, we're going to move over here to techniques of the group, which is chapter 4. So the integrative approach to group practice is developing an integrative approach is a process that will likely take years and evolve as you gain. Consider your own personality, interpersonal strengths, life experiences, and worldview as you choose the concepts and techniques that work best with a range of clients. And there are multiple pathways to achieving integration. 2 of the most common are technical integration and theoretical integration. This is an integrative approach to group. Thinking, feeling, behaving model of group is combining the following 3 domains I just discussed. The cognitive domain focuses on the thinking, the affective domain emphasizes on the feeling, and the behavioral domain entails the acting and the doing, which is almost like an ABC, right? Using group techniques effectively. Techniques are leader interventions aimed at facilitating movement within a group. Virtually anything a group leader does could be viewed as a technique. Techniques are most useful when they evolve from the work of the group participants and they are tailored to the situations that evolve in a particular group meeting. And again, we want to make sure we're effective with anything we decide to do with our group. So if you have a technique or whatever, we want to make sure, 1, is it appropriate for you to give it? Does it make sense with the dynamic of what the group is? 2, do you know how to do it? Do you need to practice it? Have you run it by maybe somebody else? 3, is it within your scope of practice? Because we can sometimes learn things that aren't in our scope of practice. So we want to make sure whatever we do with our clients, that it's within the scope of practice. And, in order to do techniques, your clients have to trust you. Are they ready? Can they handle what may come up after the technique? It creates cohesion, which is beneficial. And maybe more trust amongst group members. So it could be really beneficial. I think it's just making sure it's appropriate and right. Okay. I wanted to talk to you guys about experiential and relationship-oriented approates. So it's existential. We have the capacity for self-awareness, which, experiential kind of comes from when we talk about hierarchy of needs and things of that nature, that some of that may apply. Because we are basically free beings, we must accept the responsibility that accompanies our freedom, and we have a concern to preserve our uniqueness and identity. We come to know ourselves in relationship to knowing and interacting with others, but sometimes that can be a huge challenge for people. So in this perspective, though, the significance of the existence and the meaning of our life are never fixed once and for all. So it's constantly changing, right? Instead, we recreate ourselves through our projects. Anxiety is part of the human condition, and death is also a basic human condition, and the reality of our mortality heightens our sense of ultimate aloneness. All very heavy stuff, but beneficial once you decide what kind of technique you want to use or theory you want to use when it comes to what theory really fits the way you want to do therapy and goes with your mold. You want to find something that works for you and feels like you would be able to implement it easily. That's really important. Really, really important. Gestalt, like I mentioned, is an experiential therapist. Virginia Satir, I believe, is an experiential therapist, talking about the here and now, awareness, bringing unfinished business into the present and dealing with it. Let's move on, move forward. And we can't do that if we're constantly stuck in the past. Some of the factors that are emphasized include therapist presence, authentic dialogue, gentleness, direct self-expression by the therapist, and a greater trust in the client's experiencing. So we want the clients to experience what they need moving forward, and we want to be the person that helps guide them in that direction. All very good things, just some challenges, right? But like with anything, you learn, you grow, you figure out what works for you, what doesn't work for you. I don't expect your videos to be 100% perfect, but I would like to see that you're making attempts to better understand group and better understand what the rationales are behind group, okay? So I hope you all have a great week. Let's keep working on those assignments, and I will talk to you soon.